dignity and quality of life. Many prefer the independence of receiving care in their home, but for too many, that is not an option. And we know that home care is often less costly. We are too reliant on institutional care. We are going to change that. If what I say about the investments in the community in primary care and home care has a familiar ring to you, this should not come as any surprise. It's been spoken of constantly, but we aren't interested in just talking. As a first step to put care in the community, we will invest the Federal Health Accord dollars this year in home care services, catastrophic drug coverage, and the development of family health teams. This will help us build our capacity to care for people in their communities and integrate community services with institutional care. Finally, let me speak a little bit about the fourth positive change strategy, a more expansive focus on healthy living and prevention. Our goal is to help Ontarians be the healthiest people in Canada. This is a target we can meet, and I'm so pleased that my parliamentary assistant, former Olympian Peter Fonseca, has signed on to help show us the way. But good health means more than being free from illness. It means more than having a bone set properly when it's broken or a wound treated promptly. Good health encompasses a broad range of factors, including nutrition, environment, exercise, disease prevention, health promotion, and health protection. We've developed a good model for treating illness, but we don't have an effective strategy for keeping people well. And we intend to move aggressively to give all Ontarians the resources and the support that they need to achieve good health. It doesn't matter whether you're a senior citizen, a farmer, or a logger. Our goal is to improve your health. To make Ontarians the healthiest Canadians, we will tackle the most high-cost, high-burden, and preventable health issues. These include smoking, childhood obesity, onset by inactivity, and disease. Our government will undertake an aggressive plan to reduce tobacco use, to protect people from the harm of secondhand smoke, helping those already addicted to quit, and preventing our youth from taking the leap to this deadly habit. And on that point, I'm often amazed that I drive by high schools in our province, no longer offering grade 13, and therefore having very few 18 and 19-year-olds in them, to see minors smoking. And you got to ask yourself how this could be. I sometimes wonder, who are their dealers? And what are we doing as a society to stop young people from taking up this most deadly habit? The social and economic costs of obesity are also enormous. Obesity often starts in childhood, and many of the causes and cures are well known. In fact, I've been a poster child for trying to get past something that I've carried around for a long, long time. And I'm still working on it. Our government will attack the root causes of obesity on two fronts, by increasing physical activity and promoting healthier food choices. And we'll do that in our schools, and we'll do that across the broad reach of our society, and government will demonstrate this leadership, but success will take all of you. It will take all of us. Another area we must tackle is domestic assault, not only because it is a reprehensible social problem, but because it consumes a remarkable amount of health resources. As we go about our daily lives, all of us can take real action to help ensure the sustainability of our healthcare system. Just as with energy conservation, choices you make today can help ensure healthcare will be there tomorrow. By choosing to take the stairs or walk around the block or preventing a teenager from taking up smoking, you can make a contribution towards a more cost-effective healthcare system. It's logical to question how modest sacrifices made by just one of us can possibly make a difference to the survival of publicly funded healthcare. But multiply those benefits by 12 million of us pulling in the same direction, and you will all see that there are significant benefits indeed. And if you need any further lesson on this, look to this young man, Kristopher Knowles, for the active leadership that is within each and every one of us. Healthcare is a $28 billion pie, stretched out across an unimaginable number of boundaries. Boundaries between hospitals, regulated health professions, labor and management, and even religious orders. Let me also come back to an issue I touched on earlier, and that's the issue of money. I acknowledge the inherent tensions in the healthcare system around money. I certainly knew they existed before I took this job, and I certainly know it today. These tensions will always be there, but we can take huge strides towards better healthcare beyond just spending money. I don't believe every issue can be reduced to a showdown about dollars and cents. There are a lot of other resources, a lot of collateral good in our system which can be leveraged. That's the Medicare advantage. The task at hand is a tough one, and it will challenge the status quo. Some familiar and established structures will be transformed, or may even disappear altogether, while newer ones emerge. There are many entrenched interests who may be resistant to change and who may argue against necessary reform. But we must recognize always that we are in this together, and in the end, we will all share in those benefits. I believe our government has provided some real leadership on these issues, and in the coming months, I'm determined to work with you to move forward with the transformative changes I've outlined today. In closing, I would like to leave you with one final thought, a challenge actually, a challenge to all of you to be part of the solution. A truly effective, patient-focused healthcare system is within our reach. In fact, many of the components are already in place. What we need now isn't simply more money, but a more determined effort to make the various parts of this system work in harmony. It's time to say goodbye to the silos. It's also time for a cultural change, time for a new atmosphere of trust, accountability, and cooperation, an end to the bickering and the turf wars, and the beginning of a new collaborative effort to make this system fire on all cylinders. It's also a job for all of us. Every single Ontarian has a stake in the outcome. Every single one of us has a contribution to make in the transformation of our healthcare system. I say it's time for Ontario to lead the way again. Let's get it done together. Thank you very much.
Thank you so much. Thank you so much for taking time out of your busy schedule to address the Economic Club of Toronto. We're grateful, and thank you. I feel a little guilty now to enjoy our desserts, I think. We promised everybody we have everyone out of here by 1:30. Just let me say that this is a typical Economic Club of Toronto event, and we haven't experienced one before. Please leave us your business cards on the way out. If you haven't already done so, we can keep you informed of all future events. We have a number of wonderful events forthcoming. Once again, thank you, Minister Smitherman. Thank you, all of you, for attending. We look forward to seeing you again in the near future. Thank you.